Hello, I'm Rosie from Hello magazine. I'm also a proud ambassador of Wellbeing of Women. It was an important moment for us all when Hello and Wellbeing of Women teamed up in 2021 to launch the Menopause Workplace Pledge, a drive to see women going through the perimenopause and menopause stage of life better supported in the workplace. The campaign was a huge hit, and to date we have almost 3,000 UK companies signed up. But it doesn't end there. We know there's a willingness to improve things, but what does tangible and meaningful support for women going through the menopause in the workplace actually look like? And how can we ensure that both managers and employees are able to access the help they might need? If these kinds of questions have been on your mind too, you're in the right place. In this short video series in the lead up to World Menopause Day, I will be meeting 3 game-changing women to hear all about their experiences in this area, to ask for their tips and gain some brilliant insight and advice for us all. So whether you're a manager, an employee, or a woman going through this time of life, stay tuned. My first guest is Dr. Nighat Arif. She's a GP based in Buckinghamshire, and you'll probably recognise her face as she's the resident doctor on ITV's This Morning and BBC Breakfast. Not to mention a prolific TikTok and Instagrammer, where she uses her platform to advocate for better women's health, and especially for those from underserved communities. Her first book, The Knowledge, An Essential Guide to Female Health, was published earlier this year, and she's also an ambassador for Wellbeing of Women. Dr. Nighat, thank you for joining me.
Good morning, Rosie.
Good morning. Let's start in your role as a GP. What trends are you seeing in your clinic with regards to perimenopause and menopause?
When it comes to trends, the biggest issue that we're seeing are the psychological symptoms, because women find either they're too scared to talk about them because it's such a taboo to talk about mental health anyway, and not associating that with their cycle. So is it a mental health condition that you're dealing with, or is it perimenopause? Because women come and see me and say, well, I'm still having periods, but I'm having anxiety, low mood, tearfulness, irritability, anger that I never used to have before, Dr. Arif. I'm getting brain fog, I'm forgetful, my confidence is really impacted. I'm going to meetings and I've lost my the thread of thought, and I feel that my self-esteem, and I'm undermined by colleagues who are much younger than me in board meetings. So I think that when you look at that and you think about the psychological symptoms related to, say, anxiety, clinical anxiety, or clinical depression, there is an overlap, but we still need to be able to differentiate the fact that our hormones, estrogen and progesterone, that are fluctuating can cause psychological symptoms of the menopause. It's not just the vasomotor symptoms. So the vasomotor symptoms are the physical symptoms, such as hot flushes, night sweats, palpitations, formication, which is like the feeling of pins and needles or spiders crawling up your legs, headaches or migraine as well that can happen. You can get tinnitus, a burning sensation in your mouth. There's a whole load of physical symptoms, aches and pains, so something known as arthralgia. So the trend that I find most when I sort of do my clinic is that it's that differentiation and the nuances of what is perimenopause, but what are other diagnoses that I need to consider as a doctor. So that's one thing. The other trend that I see a lot is libido. Women are now happier to come in and talk about the fact that intimacy of their libido is lower. And I think that's got a lot to do with the fact that we are openly talking about sex. We are openly talking about the fact that our libido does decrease. And also women now feel that they don't have to put up and shut up about it, which is lovely. That's music to my ears as a doctor. The things that were hidden about talking about your sexual desires, because women aren't meant to say that they love having sex or they want to have an orgasm. Now that is coming to the forefront in my consultations, and they're bringing it to the doctor to say, could you help me with this?
So with so many symptoms, I mean, it's quite mind-boggling, really, the amount of symptoms that you could get that could be related to the perimenopause or menopause, or could be related to something else. Where should a woman start to actually get that diagnosis?
The first question I always say before I answer that is, what symptoms warrant me even going to the doctor? So a lot of women say, do I need to go and tell the doctor that I'm perimenopausal? Because if I fall pregnant, that's the other time in their life, there's a life event that happens. I don't go to the doctor and tell them I'm pregnant. I just then wait to get my 12-week scan because I contact the midwife and I bypass the doctor altogether. the symptoms that are affecting your activities of daily living and your ability to carry on things, that's when you go and speak to the doctor. And so the question arises is what symptoms then warrant you coming through the door, and what do we do further? So that is really based on, again, how much those symptoms that you're experiencing, because there's about, as you know, Rosie, 42, and they're growing, aren't they? It's like every single time I speak to a new patient, I'm adding a new symptom. It's what is stopping you from doing what you want to do, and if they are really impacting your quality of life. We are built for survival. Our bodies are built to survive this phase. Just like when we started our puberty years and we had hormone fluctuations, our boobs were forming, our hips were developing, and then our periods had started. Our body was built for survival then. It's exactly the same on the opposite side of our life when we come to our midlife years, or as the Chinese call it, the second spring. So you're rejuvenating, you're regenerating again, and your body's built for survival. But it's about whether you are now looking for thrival, and that's where I, as a doctor, step in.
Yeah, so you would say don't put off making that doctor's appointment if you feel that something's off. What about women from different cultural or ethnic backgrounds? Are you seeing an increase in those women coming to your GP clinic? You mentioned talking about libido, and there are so many topics that feel quite difficult within certain communities to discuss openly. Are you seeing an increase in women feeling confident enough to come forward to address those?
I'm definitely seeing a trend, and that's because women are now feeling that they're part of the conversation. But we've got to look at marginalized communities as a whole, because the ethos around those communities is the fact that actually you shut up and put up with a lot. And that's because of historic internalized misogyny that we have. We do have institutionalized racism, and we have medically gaslit women for quite a long time, regardless of whether they're from marginalized communities or not. So when a woman goes to the doctor and says, I've got aches and pains and brain fog and hot flushes and palpitations, but I'm still having periods, the doctor, depending on their knowledge, will say, oh, no, that isn't actually, brain fog isn't real. And I've genuinely sat when I was a junior doctor in clinical consultations with a gynecologist who told a woman that her brain fog isn't real. And so I think we've got to think about how much these marginalized communities from Black and Asian communities are researched. So we've got one study, one effective study, but that actually is done in America called the SWAN study in 2020. Yeah, and that showed that when women from Black and Asian communities, they actually probably present earlier with, say, perimenopausal symptoms, so hot flushes and night sweats. So the average age, we say, is about 40 to 45 in white Caucasian populations. But Black and Asian communities, it's about 38, 39. And it could even start with symptoms of, say, vaginal atrophy, where you get dryness or that itch that doesn't go away, that repeatedly, when the woman from, say, a South Asian heritage goes to the doctor, is told, oh, it's thrush, here's some Canesten. She goes away and it gets better a little bit because what's in Canesten, there's a little bit of steroids in there, and that's going to take the itch away. But the underlying issue of vaginal atrophy isn't spoken about. And if you look at consultation notes, my data, when I first started talking about menopause in Black and Asian communities, was that only about 10% of consultations ever documented vaginal atrophy. Whereas I know as a doctor, about 85% of my consultations are those women experiencing vaginal dryness, painful sex, they have difficulty having smears. And then that has added on consequences that they don't come in for, say, cervical screening, and then also recurrent urinary tract infections. So then on top of that, to talk about your libido, that's even more of a taboo, right? So you're not going to offer those symptoms up to the doctor, because what happens is that when it comes to Black and Asian communities, they're more likely to offer up things that they feel are less taboo. So the physical symptoms. So I get aches and pains. So I usually will get women, Pakistani women who come into my clinic who'll say, Sara kuch dukhda hai, sir to leke paira tak, which is translated as everything hurts from my head to my toe. And that I know is arthralgia, but actually that is a symptom of perimenopause as well. But if I say to them, do you have any psychological symptoms? And the first thing they're saying, no, I'm not depressed, or I don't have a mental health disorder. Don't label me with this, because it's such a taboo within our culture, because we don't have a word for, say, mental health. The word that we have is madness or pagalpan. So when you use that word, which is translated as mad, obviously you're not going to use that, which leads me on to the next thing about communication within Black and Asian communities. If you look at a lot of the languages, we don't have direct translation for, say, the menopause. In Punjabi, we have kapde khatam ho gaye, which is translated as you're off the rag. And in Urdu, it's banji. Banji is translated as you're barren. So again, not direct translation of, say, menopause or perimenopause. And so when you don't have the lexicon to be able to, even within your group of women, within your community, to be able to communicate by using the words, you think that it doesn't exist, or it's not pertinent for you. So you actually gaslight yourself within your own community. So I see a lot of women at the mosque who are saying, I think what you're describing is, and I use the English word, menopause, and they'll literally laugh at me and say, no, Dr. Nighat, that doesn't happen to us. Menopause is a Western phenomenon. And I'm aghast when I hear that, because essentially what they're doing is that they're nullifying their own experience within themselves. And then they say, well, it's not important enough to offer up the symptoms of hot flashes, because the context of my symptoms is you stand in the Pakistan heat and you'll know what a hot flash is. So the context of my symptoms aren't enough to warrant to go to the doctor, because the doctor's appointment is so precious. He or she has got cancer to deal with. Why would they be bothered about my sort of menopausal symptoms? So we have this sort of area, this grey area, where women are suffering but won't be able to go to the doctor to support. And the doctor, who might not understand the cultural nuances, won't be able to prize apart those symptoms and educate them and say, this is really important. But with the medium of social media, I produce content in Punjabi and Urdu. And now women are saying, oh, actually, there's a doctor that looks like me, so if you can see it, you can be it, who's saying to me that these symptoms are significant because they're linked to, say, down the line, I'm at risk of osteoporosis. Down the line, I'm at risk of heart disease. And then they're saying, right, I need to not just survive, I want to thrive and prepare myself for the future.
So other resources like your book, the knowledge is so valuable, and that's a very inclusive book. Some of the diagrams that are in that book are very graphic, and they, depict women from all different kinds of nationalities and cultures, which is so critical in opening up this conversation. And how could a woman then advocate for herself within the healthcare system?
I think firstly, we've got to look at women are busy. Right, regardless of, I've never seen a woman who is not busy. And to be fair, men are busy as well, but women are multitaskers. So what a woman does is she'll look after everything else in the household, and then her health is right at the bottom. So even her awareness of her health only happens when that problem presents to her. So if you are looking through the lens of privilege, that you've never had heavy periods or you've never had painful periods, then your assumption is, well, everybody is like this and I don't need to pay attention and I don't need to do anything about it or have these conversations. But if your lens is, I suffer from PMDD, I've had fibroids, I've had a hysterectomy, and now I'm in surgical menopause, then your outlook on life and your investment in your health is going to be completely different. The awareness that comes is that we as women need to make sure that we're opening up these conversations, which historically have been taboo. Why have they been taboo? Because our bodies have never been our bodies. I mean, in 2023, we're still talking about Roe versus Wade and the fact that the government decides, when I can have an abortion or not, when we know abortion is healthcare. So when you've got governments across the globe and the patriarchy is at play to make sure that your body isn't yours because your breasts are sexualized, your vaginas and vulvas are sexualized, even just your whole body as a whole, your face is sexualized, cover it up, then having those conversations gets even harder, but that only comes from empowering each other. So as women, the idea is that we stop seeing color or creed or class or hierarchy or doctors versus, we're the ones with the knowledge and these are people who do outreach groundwork. We need to break that down and to be able to have open dialogues and have ambassadors and people who look like you to be able to give the message out in the nuances that your culture understands. So I'll give you an example. Somalian women in Newham, Tower Hamlets, if I go in there as a Pakistani woman wearing a hijab and say, here's a picture of the boobs, look at my book, this is how breasts should be examined, they'll be appalled by that because that is so away from their cultural nuance where things like this are hidden. But if I make some bread and make them into dough balls and then put in some frozen peas and say, right, I'm going to teach you how to examine bread. Imagine this is your breast. And this is what a lump would feel like, because this is the frozen pea. They will reciprocate that message 10 times fold, because they never keep that information to themselves. And it's given in a way that respects their cultural way of doing things. I think that when we say, how do we open up this conversation? I'm always aware that we must be really careful that we don't come in with this savior complex. I will come in and educate all these women because they need to know about their bodies. Take my book, The Knowledge. You need to know about your body. And this is my savior initiative for you. When actually women know themselves really well, they know their bodies. And my 15 years as a doctor will never replace a lived-in experience. Even my book doesn't replace a lived-in experience. But where the magic happens is when you get women who have that lived-in experience, you empower them enough to amplify and do what they're doing already without realizing that they're doing it, and then get it out there to others. And then others watch her doing it and they replicate it. And so the domino effect starts. And we've seen that, with Davina, you as well, at Hello Magazine. We've seen that with Lisa Snowden, the menopause mandate. We've seen that with incredible women, Neelam Hira at Sisters, talking about her PMDD as a Sikh woman with endometriosis. This is what we need. We need to champion those grassroots organizations.
Yeah, you're so right. There is so much power, isn't there, in sharing our stories. Let's talk a bit about the workplace, another place where women can perhaps support each other in sharing their own stories around menopause. But what does tangible support for a woman at the menopause or perimenopause stage of life look like in the workplace, in your opinion?
I do a lot of work with lots of huge businesses. I've recently started working with Google and YouTube, and Alison Lomax, who's the MD, so I asked me precisely this question: how can we support the women? Because I don't want to lose these highly skilled women. It's estimated that if we don't support women in the workplace, we're going to lose, at the perimenopausal phase of their life, we're going to lose about 1 million women, which to me breaks my heart, because you think this is something that's correctable and fixable and also manageable, that we shouldn't allow women's biology to make them step away from a career path that they work so damn hard for. So tangible support to me looks like the first that you open up the conversation, and that starts at leadership. And that by doesn't mean that starts at the MD level. That could be leadership right at the bottom, where actually the workers are doing their work, and somebody putting up their head above the parapet and saying, do you know what, I've got hot flashes, and never having a shame or taboo attached to that. Menopause cafes are happening. So I know that the BBC, I've worked with Royal Mail as well, and Tesco and Sainsbury's, huge businesses like this, understanding that the woman is the one that they need to cultivate and protect, because she will give 10 times fold to that business and look after your business. Then the other thing is looking at the clothing. So Tesco's have done this amazing thing already, where they're looking at the fibers that they're using in regards to the uniform that they wear. So it could be breathable, it could be one that absorbs your sweat, and there's loads of work happening with that. There's also a lot of conversations happening around femtech as well. So wearable technology that allows women to understand what their heart rate is doing, what their palpitations are doing, what their sweats are doing. And then also thinking about her now cycle in regards to her hormones. So if she's suffering from hot flushes and insomnia, and you've created an environment in your workplace where she's able to go to her male boss and say, look, I'm not sleeping very well because of my hot flushes, that she has workable adjustment hours, because then she's in at the time, or even now since the pandemic, working from home as a possibility rather than physically being in a space all the time. And I also find that the other tangible effects that can really help is simple things that we never think about. Sanitary products in workplaces. Like, honestly, my heart sings whenever I go into a toilet. And there's no NHS hospitals that I still go into that still have sanitary products for free. But it makes such a huge difference, because if you think about it and you're a perimenopausal woman and you're caught off guard, to know that you can then just, get the products that you need to stop your flooding at that moment, it makes a world of a difference in the workplace as well. And I think lastly, we've got to be able to create the culture where other communities, so Black and Asian women in workplaces, are also part of the conversation and they're not excluded. Ask them, what can we do to support you so that you can carry on? In my culture, we have a saying that you give a woman some seeds and a plot of land, she'll build you an orchard. And I think if businesses thought that way, that if we support the woman, my economy and my business will thrive, then that's an incentive to make sure that you have tangible things in the workplace to keep that woman there, because she will build you an orchard.
It's such a simple phrase, isn't it? But it is so powerful, that what can I do to support you? It's such a brilliant question. So if a manager is watching this, and perhaps there are lots of midlife women at the company that they work at, and perhaps they're a male manager, and they want to improve the environment for the women that work for them, so that, productivity goes up, everybody's happy. Yeah. When a woman feels like they're listened to, they feel fulfilled, and they do go that extra mile, as you've said. What could be the first step that sort of manager could do? So they've signed up to the Wellbeing of Women Workplace Pledge. They want to take things to the next level, but they don't know what that first step could be. What could that be?
So you actually put the nail on the head, listening. Listen to the women in your group. It's such a simple thing to do. So if you've signed up a workplace pledge, and you can have an individual like me as a doctor to come in and help assist the medical aspects, so the knowledge that you can have in order to just support yourself in regards to the symptoms. But I would say, firstly, male or female, because this is not a gender issue at all. This is not a woman's issue. This is everybody's issue within the workplace. And as a male colleague, I would just reach out to all of your workers and say exactly that. What can I do to support you if you are having perimenopausal and menopausal? And educate yourself first about what the perimenopause is. And that is so simple to do now with so many online resources and women sharing their stories. Then the next thing is build an environment in your workplace where women do feel that they can talk about things confidentially and not feel penalized down the line. And that, I know, is very variable depending on HR and all different sort of politics that go in workplaces. And then thirdly, allowing women to have a space where they can have that space to have those confidential conversations. So that could be setting up a menopause cafe or a training day that they can go on to learn from each other how they manage their symptoms, as well as get healthcare professionals or say menopause advocates or physical exercise and nutrition, because we know that it's not just always a doctor that you need. There's loads of other holistic lifestyle things that can be offered. And I know it's going to be very variable on the amount of budget that a company has and the size of a company as well. But this doesn't mean that this is a woman's issue. This is everybody's issue, because if your end point is, I want my business to thrive and survive in this current economic climate, it has to start with you investing in the women and girls that are working in your business.
I've heard some great success stories of menopause cafes, as you suggested, menopause groups, perhaps finding a menopause ambassador or an advocate within the company. All of this conversation can be opened up by simply a manager going to the workforce and asking them what they need. And as you say, then the women sharing their stories within that group is absolutely priceless information. What about on the other side, if an employee is feeling that they're not coping in their work environment, they love going to work, but perhaps, what they're going through, perhaps starting to try HRT, or they were experiencing some symptoms which can be quite debilitating, from the brain fog that you mentioned. I mean, I've had moments myself where I completely couldn't remember the name of a colleague that I'd worked with for years. And she was sat across the office from me, and I had to go and look up the phone list to jog my memory. I mean, it's terrifying. That was before I went on HRT, and it absolutely changed my life. But how could somebody like that open up a conversation with their manager in the workplace? Is it an HR question? Is it something to discuss with your colleague? What could you do?
So I always say that I'm very aware that I look at things from a lens of privilege as a doctor, and I'm like, and I'm quite vocal, and I have some medical knowledge. I'm like, yeah, just talk about it. But I completely understand for some women, it's not that easy or that simple just to go and talk about it. And I think this is where finding advocates or allies is, the magic sweet spot again. So those individuals, and it doesn't have to be somebody from HR or your line manager, it's somebody who can advocate you. That could even be a friend outside of work who doesn't understand your work situation, because sometimes you could be in the eye of the storm and not understand the dynamics that are happening, but actually getting another viewpoint from a second opinion from outside actually really helps. Or somebody who might be in a different line of work who goes, oh, have you ever thought about doing it this way? Because when we're working in our trajectory, we've got our blinkers on, And then the question is, but we've always done it this way. And this is what I hate about medicine, because we sometimes as doctors have our blinkers on and never sort of think about the wider view. And that's why a second opinion really does help. And this is a really quick tip for anybody that wants to go to the doctors. If you go to the doctor and you feel that you're not listened to, there is no shame or stigma attached to getting a second opinion. I mean, I say this as an NHS doctor who constantly asks for second opinions, because you never know everything, all the time. And there are some patients who are slightly more trickier. That's not their fault. It just means that they don't fit the medical textbook, because they have a completely different lived-in experience and circumstances. So that works really well. So allies, second opinion, writing things down. I think journaling and jotting things down and keeping a symptom diary would really help your manager to understand how you're affected, especially if you have difficulty verbalizing it in person. Because we downplay, there's a lot of modesty that goes on, and you downplay. And I always say that some of my patients are incredibly stoical, and it only helps when the husband says, actually, no, she hasn't been sleeping every night, Dr. Arif, and she's just being stoical in front of you. And that really helps when you go to the doctor as well. So if you want to then go to the other thing is that with your workplace, you need to get a combination of help from your doctor, especially if they're debilitating, as you were saying, Rosie. And they need to go hand in hand. And I say to my patients, I have a 5-point plan if you're going to go and see your NHS GP regarding support. Number one is please keep your symptoms and find that ally, whether it's work or whether it's a home, or somebody who can advocate for you. Number two, phone the surgery and book a double appointment. Speak to the receptionist and tell her, I want to talk about my perimenopausal symptoms and they're debilitating for me. The reason you do that with the receptionist is because then she can triage you to the best person in the surgery. It might not be your registered doctor. Number three, when you go to the doctor, take your symptom list with you, take your ally with you, and then have that open conversation. Bring your family history. Make sure that you have a latest blood pressure reading. If you know that your blood pressure goes up when you see the doctor, have a height and a weight, because we need to know what your body mass index is. And any other thing, like if you had a history of breast cancer or strokes or COTS, we need to know about that. And also your experiences with other hormones like the contraceptive pill or the mini pill. Then number four, be prepared. And number four, be prepared that on the first consultation, you will not leave the consultation with hormone replacement therapy as a prescription. It is actually rare, even for me as a doctor, to on the first consultation to say, here you go, HRT for your brain fog, your night sweats, because I want to rule out other conditions. I need to make sure that it's not because you've got a thyroid condition or anemia or diabetes or any, God forbid, some cancers that I need to think about that can also mimic the symptoms of the menopause. And then lastly, if you've had a good consultation with that doctor, as you leave the consultation room, book on all your investigations, and then speak to the receptionist on your way out and say, can I pre-book with Dr. Arif, who's brilliant, and
yes,
I want to see her in 6 weeks' time, because most NHS GP practices, they open their diaries 6 weeks in advance. So it's really important that you have continuity, and to get continuity, you need to be the person in charge of that, and you need to be the person in charge chasing your blood results. And that's how you have a combined, holistic, and also a partnership with your GP. It's not your GP doing everything and telling you what to do. You have to work in partnership.
You have to advocate for yourself. Some brilliant advice there. Thank you so much. That was super helpful. Is there anything else that you want to add just quickly at the end about any other way that you could get support within the workplace?
Within the workplace, one of the things that women never talk about is vaginal atrophy. And I know that because I get women from the workplace talking to me about it. So that's itching, soreness, dryness, also painfulness in their work clothes or the uniform that they're wearing. And that's such an embarrassing topic to talk about, because some places they just advocate trousers and they don't allow you to have skirts, etc. So I think that has to become a mainstream conversation and not keep it hidden anymore. So speak to, like I said, your allies, your advocates, and think around the fact that it's not just, as one line manager once said to me, who was actually a man, who goes, it's just a bit of hot flashes, isn't it, Doc? And I'm like, actually, no, it's not just a bit of hot flashes. That's probably what some of the women have told you, or your assumption has been that it's just hot flashes. But you do realize that if you're wearing really hard fibers, because remember, some women have really physical jobs. They might work in a factory line, and the fibers are synthetic and they're rubbing against their vulva and their vagina. You need to really think about the fact that how can we implement better change for these women so they're not having worsening symptoms. So this is where vaginal moisturizers are really important. So I say to women, if I had my sort of wish list as a doctor, is that any friend or patient over the age of 40, I would say to them, just start using vaginal moisturizers. So prevent vaginal atrophy from happening, because we know that about 85% of women. Vaginal moisturizers are full of hyaluronic acid, which is this lovely chemical which just absorbs water and moisturizes really well. There's no estrogen in that at all. And you just apply it twice a day. I'm 39 and I use one that's called Yes, but there's loads of different brands out there, Hyalofem as well. And you can buy those and use that to prevent vaginal atrophy, because you'll probably notice just around your periods that you are getting some vulval skin changes. And so that's the other thing, examine yourself a lot down there as well. We are very good at examining our boobs, but we don't examine our vulva and vagina. And then if you need to, then go and speak to your doctor about vaginal estrogen. And this is where that open conversation about a holistic approach in the workplace and then the medical team being able to offer, say, vaginal estrogen is where that magic happens.
The education in the workplace is so important for everybody, whatever age the woman is, and for our men folks too. And it's not enough to just put up a poster around the building, although that's very helpful as well to alert us to the symptoms. But there are much more meaningful ways that you can create a work environment that is going to have a positive impact on everybody and support women through this time of life. So some amazing tips there. Nighat, thank you so much. You're such a mine of information. And of course, your book, The Knowledge, is a great place for people to go to start off getting that kind of thorough understanding of what happens to our bodies from menstruation to menopause. The Hello Hub as well online, all about the menopause, has lots of credible information. And of course, the Wellbeing of Women website will continue to keep both employers and employees updated on how they can provide support in the workplace. So thank you so much for joining me today. I found that really fascinating. And it's positive as well. There's hope for all of us, which is a really great message to end on as well. There's so much we can do.
Absolutely. And I always say that one of the things that women, like 20, 30-year-olds on my TikToks or my social media, say, oh my goodness, I'm dreading the menopause. And I'm like, oh no, really don't be, because we don't dread puberty. We don't really dread pregnancy. And this is just another life biological journey that we go on as women, and we transition. And transition brings new hope, opens new doors, opens new conversation, even new relationships.
Absolutely. Help is out there as well.
Help is out there.
All the information and help is out there.
And I feel now there's been a real shift in the conversations around our bodies, and we're reclaiming our bodies as our own. And there's a real sisterhood that's formed. And I think that's an underestimated or unrecognized superpower, because once you find the right group of girls around you that you can talk about stuff like that, then you're on the right road to happy.
Yes, and it's very empowering. So that's a really lovely positive note to end on. Thank you so much for joining me. And happy Menopause Awareness Month, of course, as well.
Happy Menopause Awareness Month.
Thank you, Nighat. See you soon. Bye.
Bye.